welcome to another edition of the KellumMD.com video podcast. Dr. Daniel H. Kellum Jr., Gabe Farias here with Kellum Family Medicine and Kellum Physician Partners. And Dr. Kellum, this week's topic, if you've watched football, college or pro, you see the players that are wearing pink, and they're doing it to support breast cancer awareness.
Yeah,
Awareness Month, and that's going to be our topic for this week. I'm sure you get a lot of patients that come in and want to ask those simple questions. I'll jump right into it. Is breast cancer something that's passed down from generations? Is it a hereditary kind of ailment?
Well, there's a lot to unpack in that question, Gabe, and I would just say, yes, it's a very serious topic, but I will say this is also a topic that brings a lot of hope because the 10-year survival rate has dramatically improved in the 30 years that I've been doing it. So if there's a fear of getting a mammogram for ladies because they're fear of getting positive, I want them to see if somehow we can overcome that, because there's more positive and hope than there is dismay in that. And so that's the first thing I want to say. Secondly, breast cancer comes in a variety of things. So about 40% of the women that get breast cancer do have some hereditary disposition. And those are the ones that we look at from genetic testing. People commonly hear things like BRCA testing, things like that. Those are the things that give people some hereditary predisposition. But one of the problems, I will say, is that 60% of the ladies are the first time in the family getting it. And so unfortunately, what we see is some people may put it off because, oh, we don't have anybody in our family that has breast cancer. And that's one of the messages, if we can drive it home today for all of y'all, is that get it checked. 1 in 8 million women, 1 in 8 million women are going to get 1 in 8 women are going to get breast cancer this year. And so there's a huge prevalence, and we don't know who's going to be immune and who's not. And so for everybody out there over the age of 40, get a mammogram done, because it's not just about hereditary. Environmental lifestyle plays a part of that as well. Exercise, weight, all of those kinds of things makes a difference with that. And so we want everybody to check, especially, we bring it out this month so that people can understand that. But to answer your question, no, it's not all hereditary. There's definitely incidences without hereditary predisposition.
And I know that doctors like your brother, John Kellum, even yourself, Dr. Kellum's an OBGYN. He encourages his patients to do self-tests just to see if there's something there to kind of start that process. But really what you want to do, what's the age that you really want to start looking at this?
That's a really great question. In your early teens and 20s, it's probably reasonable to begin. I will tell you, as a doctor, just so people know, when we started examining people and learning how to examine people, we would often examine an abdomen or examine a breast, and we really didn't know what we were doing. It comes in time where you actually you catch the abnormals because you've done so many normal exams. So I encourage that with women. Start early. Check your breasts, start quadrants, and go around and do both sides, and do it on a regular monthly pattern, because hormonal changes within a month can create some differentiation. So you want to account for that as well. But you're going to feel really dumb when you start doing it, to be quite honest, because you're going to feel like you don't know what you're feeling. But if you stay diligent and you stay dedicated to it, the one time you pick it up may be that one time that saves your lives. And I can tell you countless of ladies in our practice who have come in, felt a lump, went through the workup, and save their lives because they were diligent enough to do it. So get past the awkwardness of it if you can. Get past the idea that, I really don't know what I'm feeling, because you do. You know what your normal breast feels like. And over time, if there's an abnormality, and we pray that never is the case, but if you do, you will be the very first one to pick that up. And that is a vital component of this teamwork that we need to make sure that we prevent and or diagnose early.
And if you're a guy and you feel an abnormality there, breast cancer is not just women. I mean, men get it as well, and men need to be diligent on making those types of self-checks. And if you feel something weird, get checked. Don't be embarrassed. Just go talk to your doctor about it, because although it's not incredibly common, it happens in men as well.
1 out of 100 men get breast cancer, which is really kind of a statistic.
It's a shocking number,
really. It is. And you know what it is? It is tough because men don't usually do that. So I agree with you, Gabe. We need to put aside some of the embarrassment with that, men. And if you feel something, and in men, I will add, whether it's testicular abnormalities or breast abnormalities, but in this particular case, focus on the breast. Get it looked at. I have a patient who had metastatic breast cancer and is struggling. Thank God he's doing better. But it was because he never had that looked at, because he was not informed at growing up, that there was that risk. When we saw him, we diagnosed him, and it's been a pretty tough thing for him. And so men are not immune either. And so it would be a good time, for both men and women to be sure that they're checking things on a regular basis. Men, promote your wives and girlfriends to go get this done, because it can save their lives. And women, beyond your man about checking, because I think that's a really important part of how we make things better. And so these are tough topics, I think, and tough things to do on a regular basis, but it makes all the difference in the world in saving your life. And we can make a difference, much like many cancers. If we're diligent, we can make a difference with them.
So a lot of folks that self-diagnose or look up stuff on the internet, will come back and say, well, if I take X, Y, and Z supplement, I'm going to get breast cancer or I'm going to get testicular cancer. Talk about what people say when they say, well, I can't take hormone replacement therapy because it's going to give me breast cancer.
So what we do know is, in the past we used a lot of synthetic hormones, and we can get into the cellular part of it, but I think for this discussion it's a little too much into the weeds. But when we used to use synthetic hormones, the Premrins, the Proveras, those tended to not necessarily be what our body was used to. And now we've evolved into bioidentical hormones. We know that there's a risk for breast cancer with estrogen, but it could be as little as 5%. When you use synthetic hormones, it's really a whole lot worse. And so we find a ton of protective benefits when it comes to bioidentical
Sure.
hormones, from cardiovascular benefit to bone density improvement. And if we stay diligent with the breast cancer checks, I think we could mitigate that to a great degree. We catch it early. Estrogen positive tumors are things that can be treated with something called tamoxifen, which gives you a 95%
Wow.
outcome benefit in a 10-year plus minus. And so I think the benefit of hormones, the right hormones with the right providers, checking the right things, makes all the difference in the world. And so I wouldn't be afraid of that. But for now, I think the thing we're really trying to get across is prevention. And prevention and/or understanding early is the key with this month. And people, please take heed. Breast cancer awareness is a vitally important thing, and it impacts lives. It impacts generations. And so if you know someone who's had breast cancer and has survived, give them a hug. But use that example as a reason to spread the word, getting it done. Strangely or interestingly enough, we've partnered with Project Help, which is a local project, nonprofit here in the
Yeah.
Schertzville area. Alex is named, wonderful man, young man, strangely enough, with a heart of service, which is tremendous. But they're going to put on an event here October 29th. We'll have games and food and things like that, but we'll also be giving away 100 free breast cancer screenings.
Wow.
Thanks to the UT Health Science Center. Kudos to them for providing great support to our community. And it's a good time to come get answers. If you have questions or you're afraid or you want to talk in a little more private setting, come on by. We'll be here. People will be here to answer your questions. But Project Help, thanks to them, they are doing something wonderful for our community. And we're glad to be a partner with them. And really, they're leading it. We're just here to support. But it's a good time to come by. And if you have difficulty with resources, let's utilize those things, because we want people to get checked for sure.
And 210-945-2121 is the number here to Kellum Family Medicine. Also, KellumMD.com. And Dr. Kellum, we talk about this all the time, especially for this, but not limited to this only. If you feel bad, if you see something, you give yourself a self check. Don't ignore it. Call us 210-945-2121 and talk to somebody. Come in, because it might be nothing,
Right.
but I think the positive outcome that can come from coming and just getting information far outweighs the "you're fine."
No, there's no doubt about that. And so
Yeah.
always asking is better. One last point I would like to make, if I may,
Sure.
is that COVID put us back a couple of years. People quit getting mammograms, quit getting screenings because of the severity of that pandemic. And so we're a little bit behind the 8 ball now when it comes to that. And so I would encourage people to please get back to affirming where they are with their health. And this is one of these moments, I think, that we could utilize this month to really capture that again. COVID did a lot for a lot of people in a lot of different ways, emotionally, physically. But one of the big things that we're seeing is that it let cancer get ahead of us a little bit. And we don't want that to be the case. And so we have to work diligently to try to catch up. And breast cancer is one of those things. If you didn't go because you were afraid, it got a little bit ahead of you. We can still do something about it for sure. but also too, if we just affirm that everything is normal, one less thing to worry about in an age that we do have a lot to worry
Absolutely. All right, guys, 210-945-2121 or kellummd.com to get a hold of us here at Kellum Family Medicine. For Dr. Daniel H. Kellum Jr., I'm Gabe Farias signing off, folks. Have a great day.